In this video, I'm going to walk you through 5 exercises that may help ease low back pain and pain that radiates down your leg. Let's get started. I'm Dr. Cordova, a chiropractor in Houston, Texas, with more than 29 years experience helping patients who deal exactly with this kind of problem. Now, before I show you these 5 exercises, I want to explain why I chose them and why I recommend doing them in this order. When low back pain travels down the leg, I don't want to focus on just one thing. I want to address the radiating nerve symptoms, restore comfortable movement through the lower back, and then improve the strength and support around the spine. That's the order of the exercises, and how I present them in this video matters. We'll start with gentle mobility to get the lower back moving. From there, we'll use movements aimed at reducing the symptoms, traveling down the leg, and improving how the irritated nerve moves. Then we'll finish by working on strength and stability so your lower back has better support during everyday movement. Each part of the routine has a different purpose, and each one prepares you for what comes next. So rather than choosing one exercise and stopping there, I recommend following the entire sequence in order. That way you're addressing several important factors that can contribute to low back and radiating leg pain, which may give you the best chance of getting the most benefit from the routine. Always remember, only do what you can tolerate. If the exercise is giving you relief, you can keep going. If it starts to aggravate your lower back or leg pain, then stop. It means you are not ready for that exercise yet. Let's start with the first exercise. Exercise number 1 is the Cat-Camel Stretch. This exercise is designed to gently restore movement through the joints and discs of your lower back, especially if your spine has been feeling stiff or restricted. As you slowly round and arch your back, you're moving each area of the spine through flexion and extension. This helps loosen up the spinal joints while creating gentle changes in pressure through the discs, which may help reduce stiffness and make movement feel easier. It also helps warm up the muscles and tissues around your lower back so your spine is moving freely before we get into the more targeted exercises that come next. Okay, so this one is cat-camel, or sometimes people call it cat-cow, and it's the stretch. So all you're trying to do is get your spine to go into extension and flexion over and over again. This can be done seated, but in this example, I'm going to use it while we're all down on all fours. So you're going to get down into position. All I'm doing is putting my back into extension and then rounding it. Putting it into extension and then rounding it. So nice and slow, really trying to exaggerate the spine going into extension and then really trying to exaggerate the spine going into flexion. Over and over again, we're going to do about 10 movements. This should not hurt. All you're looking for is that motion. What should start to happen is you'll start to feel almost like your spine gets a bit more lubricated, like it gets loosened up. So again, extension and then rounding again. Doing that, you want to do about 10 movements of that. Per normal, like exercise things, doing 3 sets of 10 is always recommended, but all you're trying to do is get motion into there. If one of them hurts more than the other, that's also good information to keep track of and tell your chiropractor. Exercise number 2 is the standing lateral hip shift. This exercise is designed to gently shift your hips in one direction away from the painful leg side while keeping your upper body relatively still. This creates a controlled sideways movement through the lower lumbar spine. For some people with a disc bulge or herniation, this specific direction of movement may help reduce irritation of the affected nerve and improve pain traveling down the leg. As you repeat the movement, pay close attention to where you feel the pain. If your pain starts to move out of your foot, calf, or leg and closer towards your lower back, that's called centralization. That's the response we're looking for and a sign that the direction of this movement may be helping. So this is the lateral shift, and it's a bit tricky to see. It's a bit more subtle. So just picture like this section here is just shifting over. So I'm trying to keep my spine as straight as possible. So I'm just going to stand here as neutral as I can. And then it's just a subtle shift off to one side and then back to neutral again. Shift off to one side and then neutral again. One side and neutral again. What I don't want is now we're just kind of moving our hips back and forth. And so that's not going to be as helpful. So it's really a very controlled, slow movement. So you're standing here as neutral as you can. And again, that section just goes off to one side and then back again, off to one side, and then back again. Exercise number 3 is prone lumbar extension. This exercise is designed to repeatedly move your lower back into extension, which changes the pressure and movement through the discs in your lower spine. If a bulging or herniated disc is pressing on or irritating a spinal nerve, repeated extension may help reduce the mechanical stress on that irritated area in people who respond well to this direction of movement. The goal is to decrease the irritation or compression affecting the nerve so the symptoms traveling down the leg begin to settle. As you repeat the exercise, pay attention to what happens to your leg pain. If it starts to ease or move out of the foot, calf, or thigh and closer to your lower back, again, that's centralization, and again, that's the exact response we want to see. Okay, so this is the prone lumbar extension. So sometimes called the cobra pose in yoga. So you can do it like this, where you're just getting extension, but really you're gonna try to be a bit more subtle than that. So your hands are going out in front of you here, and then you're going down, and then you're just gonna extend, again, back down, and extend. So this is a bit more exaggerated of an extension than we have with the cat-camel. So you're gonna feel definitely like it's pulling a bit more on the front, and you're gonna feel it in the back as well. So, but nice and easy, nice and controlled. This is not a fast movement. We're trying to stretch that front, and you'll feel it in the back as well if you kind of tighten and control it that way. But just a really light contraction, coming back down and back up again. And so do 3 sets of 10 of this as well. Nice and slow, nice and easy. Exercise number 4 is the seated sciatic nerve floss. This exercise is designed to gently glide the irritated nerve back and forth through its normal pathway from your lower back and down your leg. When a spinal nerve has been irritated or compressed, it can become more sensitive to movement and may not glide as freely through the surrounding tissues. This gentle flossing motion allows the nerve to move without putting it under a prolonged or aggressive stretch, which may help improve nerve mobility and gradually reduce some of that sensitivity. As you do this exercise, you may feel a mild pulling or tension through the back of your leg, but it should not increase your leg pain. The goal is not to stretch the nerve. The goal is to gently mobilize it and get it moving more comfortably again. So this is the sciatic nerve gliding stretch. This one I've seen done where you can put something out in front of you, so it's something to rest your leg, but you don't always need to do that. All you're doing is think about it like a lever here. Like as your foot goes down, your head goes down. As your foot comes up, your head comes up. Nice and easy. My hand is just demonstrating, it's not doing anything. So you can kind of see you're looking down, come back up, look down, go back up, down, go back up. You really want to focus on doing this on the side that hurts, but I like to do things bilaterally, so I think it makes sense just to work both sides, and why not? Because it's going to be good for you. But 3 slow, controlled sets, 10 on each side. And so again, back and down and back and down, back and down. This is a good one too if things start to act up and you're just at work and you need to do something more subtly and you can't get on the ground. You can certainly do this stretch and it will help that leg pain go away a lot easier. Exercise number 5 is the bird dog. Now that we've worked on mobility, centralization, and nerve movement, this exercise is designed to strengthen the muscles that stabilize and protect your lower back. The bird dog teaches your deep core and spinal muscles to hold your lower back steady while your arms and legs are moving. This is important because your spine needs that stability during everyday activities like walking, bending, lifting, and reaching. As these muscles get stronger, they can help reduce unnecessary stress through your lower back and give your spine better support as you return to your normal activities. As you do this exercise, you should feel your core and back muscles working to keep you stable without increasing the pain traveling down your leg. This can be done laying face down completely, where you're completely flat and straight, and then you're just kind of lifting up. But I like to do it alternating. This is usually a lot less stressful for people. And so you're going to get down on all fours again, and then we're going to extend one arm and one leg at the same time. It's almost like you're making an X with your spine. So this arm, this leg, it's really going to help stimulate your posture muscles and help create a lot more stability in here. You really want to try to stay as neutral as you can. So again, you're on your hands and knees, and then you're extending one arm and one leg. And then I also like to lift the head up at the same time, get some of that neck exercise into it. And we're just going to do 10 repetitions and then 3 sets of 10 as well. This is a nice, slow, controlled motion as well. So we're not trying to go, real fast. We're trying to go nice and slow and even. And nice and slow and even. Those are 5 exercises you can use to help relieve low back pain and pain that radiates down your leg. If you followed along, which one gave you the most relief? Was it the standing lateral hip shift or the prone lumbar extension? Drop a comment below and let me know. If you found this video helpful, please give it a like and share it with someone dealing with low back pain or sciatica. Doing that helps more people find practical, non-surgical solutions that may help them move better and feel better. Subscribe now if you want to learn how to take care of your spine, prevent flare-ups, and stay pain-free with clear, actionable steps you can use right away. Now, if your leg pain is still persisting no matter what exercises you do, you may be unknowingly doing these things that are aggravating it. In this next video, I'll show you the 5 most common mistakes that keep sciatica from fully resolving, why some popular approaches may actually slow your recovery, and what you can do differently. Go watch this video next.